clinical engineer is involved in the equipment management of equipment, the life cycle of equipment, medical devices that is. So we deal with everything coming into the UHB, from the point of purchase to the point of disposal. We have 45,000 items of equipment on our inventory. A lot of that we maintain. And yeah, we manage that through its total life. Clinical engineering, we are heavily involved in community. We support patients with home ventilation support systems throughout South Wales, reaching from Cardiff down to Milford Haven. Run a 24-hour call-out system, so every patient, basically, if their equipment breaks down, we can supply replacement within a couple of hours. That's unique to a lot of health boards, but because Cardiff and Vale is a respiratory has a respiratory responsibility, it all centres on Cardiff to supply that service.
We look after everything from anaesthetics machines to defibs, syringe pumps, ventilators in the intensive care unit, high frequency oscillators, you know, everything from stuff that keeps you alive to stuff that just gives you a bit of relief, as in a nebulizer. It takes a long time to get trained to look after these pieces of equipment, but we've got a good team of highly trained guys up there who supply technical advice to the clinicians and make sure that the stuff is safe and available to use when they need to use it.
We tend to find, or we have found over the years, it's very difficult to employ very specialised technical staff. So we find it better to actually employ the lower level, more an apprenticeship trainee level. We bring them in and we train them from scratch. We send them on day release courses for electronic qualifications, and then after 2-3 years they become qualified with a lot of internal help and an internal training program that we create ourselves, and that has proved to be successful over the years, and we're now 6 or 7 posts into that, and it's working really well. We had a lot of values at Cardiff and Vale. We're not just a maintenance organisation. We're not acting just like a manufacturer would in maintaining equipment. We basically we support the users and everything they do, from advice to evaluating to loaning to trialing equipment, and that value is taken on board by a lot of health boards, where they employ clinical engineering staff to embed in different areas to support the clinical needs.